Assalamu alaikum. Hello everybody. Today our video is about interstitial ectopic pregnancy on ultrasound. Definition: an interstitial pregnancy occurs when the blastocyst implants in the interstitial part of the fallopian tube. The interstitial part is the most proximal portion of fallopian tube that lies within the myometrium, about 0.7 millimeters wide and 1 to 2 centimeters long. Incidence: interstitial pregnancy accounts for 2 to 6.8% of all ectopic pregnancies. The increase in the incidence of interstitial pregnancy is mostly due to improvements in ultrasound diagnosis and uptake of assisted reproductive techniques. Risk factors. Risk factors for interstitial pregnancy include previous ectopic pregnancy, tubal surgery, in vitro fertilization, ovulation induction, or history of sexually transmitted disease. It is reported that 46% of women with interstitial pregnancies treated in their hospital had conceived following assisted reproductive techniques. Diagnosis: diagnosing interstitial pregnancy may be difficult due to the similar presenting symptoms and signs with other ectopic pregnancies and difficulties in distinguishing an interstitial pregnancy from an eccentric intrauterine or isthmic tubal ectopic pregnancy on ultrasound imaging. Even when interstitial pregnancy is suspected on ultrasound scan, laparoscopic findings may be negative in early stages and present a diagnostic dilemma. Patients may present with abdominal pain and/or vaginal bleeding. Some patients may be asymptomatic or present with rupture and hemodynamic instability requiring immediate surgery. A single measurement of the quantitative beta human chorionic gonadotrophin level alone can't differentiate an intrauterine pregnancy from an ectopic pregnancy. Therefore, serial quantitative beta human chorionic gonadotrophin levels correlated with serial transvaginal ultrasound findings are recommended to determine an early intrauterine pregnancy from ectopic pregnancy. An abnormal increasing of serial beta human chorionic gonadotrophin allows to recognize of an abnormal implantation, but it is not specific to interstitial pregnancy. Pelvic sonography is the main method for diagnosis. The main characteristic feature of an interstitial ectopic pregnancy is a gestational sac located eccentrically outside the endometrial cavity of the uterus, in the region of the fundus with no or minimal identifiable myometrium on its lateral aspect. Ultrasound diagnosis. The following ultrasound scan criteria may be used for the diagnosis of interstitial pregnancy. Number 1. Empty uterine cavity. Number 2. Products of conception or gestational sac located laterally in the interstitial intramural part of the tube and surrounded by less than 5 mm of myometrium in all imaging planes. Number 3. Presence of the interstitial line sign. Interstitial line sign is an echogenic line that runs from the endometrial echo complex to the interstitial mass or gestational sac and has high sensitivity and specificity in diagnosis of interstitial pregnancy. The 2D Doppler transvaginal ultrasound has higher sensitivity because it can reveal an intense peritrophoblastic blood flow with numerous tortuous vessels. The 3D scans are very useful in obtaining the coronal scans of the fundal region of the uterus, giving a better overview of the corneal regions of the uterus. Therefore, 3D ultrasound, if available, can be used to avoid misdiagnosis with early eccentric normal intrauterine pregnancy. Differential diagnosis. Most interstitial pregnancies expand into the isthmic part of the fallopian tube, which is easy to diagnose. In some cases, interstitial pregnancies spread out medially and eventually start to protrude into the upper lateral aspect of the uterine cavity. These partial interstitial pregnancies are often very hard to differentiate from laterally implanted normally sighted pregnancies. 3D ultrasound is a useful diagnostic tool compared to other imaging modalities because it may depict the precise location of the interstitial gestational sac and differentiate it from eccentrically located intrauterine gestational sac.